Good afternoon, ladies and gentlemen. This is the House Regulated Industries Committee. And unless you're here to see how meetings are run, then welcome. Yesterday we went through a good bit of information, and I said we're going to call this meeting today as a follow-up meeting from one issue that wasn't passed out yesterday. The committee members and those that weren't in attendance yesterday, we moved forward House Bill 369. This was the PA APRN bill to allow prescriptive right for Schedule II drugs based on 5 days that the doctor has to forward the protocol composite board. If they do not respond in 10 days, it stands as what was forwarded by the doctors. Also says that the APs or the PA or the APRNs, that they have to forward back to the doctor within 72 hours of what they've done, the prescriptions. And we continue to get a little bit of feedback from that, with this opioid crisis and all. And I still maintain that these folks work under the protocol of that doctor. If the doctor doesn't want to, they set specific reporting or whatever, they can certainly do that, but they got to do a minimum of it. That left House Bill 430. House Bill 430 was a licensure bill. And the concerns that I had addressed, that I had told all the people, all the members who signed that bill, was that this was not to be a pathway to separate hanging of shingles by PAs or APRNs. And that was one of the bigger concerns that had been said. So the gist of this bill right now that you got in front of you with the substitute, there's 3 things in there since we took out the placards, handicap placards out of this and put it over in 369. So what you've got into this is a licensure bill and prescriptive rights for home health services. And another tidbit, the last tidbit on section 3 or part 3 is to authorizing the licensing folks to collect workforce data. I didn't know much about that. I didn't particularly care for that idea. Then I was told that seems to be a pretty handy thing that they do in the medical licensure, so that they can track who's at what, where they can tell where the nurses are, where this and that's it. So, that's up to the will of the committee on that issue. I would also say that under this bill that you got in front of you now, this bill is going to have to move forward to GORP. And what I need today is, we don't need to pass this bill because it doesn't need to go to rules. This bill, I just need for the members to see it. If they want to perfect the bill, then we can perfect this bill. And then I'm going to, as committee chair, I'm going to write the letter and forward this to the GORP committee. So they can then, and for those of y'all who don't know that term, Georgia Occupational Review Commission, that's that gatekeeper deal that was put up, a long time before I was here, on licensures to see if they're needed. And OPB does that discretion. Some governors over the years have never used GORP. This governor chooses to use GORP. He tends to overuse this issue of GORP, but that's all right. He's the governor, and that's certainly his prerogative to do it. And in this one, I think it's clear that this one does need the same as like 412 yesterday on that licensing, that they do need to move forward. They need to look at it during the interim this year. So if y'all would take a look at this bill, and if you see any, and if the members see any changes that needs to be made, I would certainly like to hear that. And we're going to call for testimony while you're looking. Who wants to speak on this bill? Yes, dear.
Hello. Good afternoon, members of the committee. My name is Lisa Eichelberger, and I'm the chair of the Data Advisory Committee of Georgia's Workforce Center. And I would like to speak to the survey, the relicensure survey that are done through the Georgia Board of Healthcare Licensure. I have put a packet for you, compiled a packet for you, and I put it before you to consider. some questions have arisen about the information that we're proposing to be gathered. And this is part of the Georgia annual renewal cycle for registered nurses and licensed practical nurses in the state. Um, we license nurses every other year in the state of Georgia. And so half the nursing licensure, there's 160,000 nurses that are licensed in the state of Georgia. Half of them are done each year. And so when they are mailed out or are notified that they need to go online and register, they are given a survey. It's all done online. Part of that is demographic information where they sign their name, they fill out their name and their address, an email address. And then there's an optional part of the survey. And what you have on the first page of the packet that I gave you are the questions. You can see it's front and back. And you can see the information. It's about their basic licensure information. Where did you go to nursing school? What type of nursing degree did you get? And then what's your current employment status? And all of this is optional. It is not optional for you to put your name, your mailing address, and zip code, that sort of thing, and contact information. But that's the only required information. So we're asking in this bill, 430, that the rest of the information be required as well. And what we do with that information is that it allows us to track where nurses are working. Right now, that information is used by the medical board for MDs, PAs, dentists, and it's required by law for dentists and dental hygienists. And we use that, we'd like to be able to use that information to predict trends, employment patterns, and where nurses are working. Also retirement projections. Right now, we can tell you how many physicians and PAs are planning to retire in the next 5 years. That would be very helpful for us to know in planning and education programs. We don't know that for nurses. We don't even know where nurses are working right now because all we have is where they're getting their mail, not even really where they're living, just where they get their mail. So this would help us tremendously in preparing our workforce in nurses. So you can see there are very few questions really we're asking to be able to answer them. Are you currently employed? If so, how many hours? And what your primary practice site is, and then where are you working as a staff nurse or as an advanced practice nurse, and then what's your ethnicity. We don't know that. We know that for physicians, we know that for dentists and PAs, not for nurses. The next in your packet is the information that is required for a physician, which is quite extensive. And then the next one is for a PA. Very similar information. And the next one is for dentistry. I couldn't get the one for dental hygienist because I'm over a dental hygiene program, but unless you are not registered, and all of mine are, I wasn't able to actually access that one online. But I'd be glad to take any questions that you might have about that. But right now we ask that you allow us to that's what the bill is about, is requiring this information.
All right, any questions from the members? What would?
Thank you, Chairman. Just a real quick follow-up. Would that information all be private, of course, when you're not selling that to a third party?
No, sir. The information has names, but it is not shared with anyone except it is given to the Board of Nursing. And then the Board of Nursing transmits it to the analyst at the Georgia Board of Healthcare Workforce for analysis. Then that information is not shared with anyone else. We, as the advisory board, do not see anything except aggregate data that is in one huge file.
Sure.
And it has no identification on it at all. So that information is private, and it only belongs to the Georgia Board of Nursing.
Okay, and then one follow-up. Is there any, what are your thoughts about maybe not including ethnicity? I think I've talked to some folks that as we move forward as a community of people, not to focus so much on ethnicity, because at the end of the day, if you're a nurse and a good nurse, I don't care what color you are. I just want to know that you can do your job and take care of our citizens.
Right. There's been a lot of emphasis placed on providing culturally competent and sensitive care for our patients. And we have a great deal of data that shows that it is very important for us to have practitioners of color. And so we have spent a great deal of emphasis on providing opportunities for persons of color.
Sure.
And so it is important for us to track how well we're doing in educating, particularly in providing practitioners of color. So we do need that information to know how well we're doing in reaching particularly students and educating groups of color to make sure that they're being represented, because the data is very clear that we do need to reach practitioners of color, because they tend to work with patients of color, and the care that's provided is very good. They tend to work with groups of color at higher percentages. And so it is something that we really do need to know in Georgia.
Okay, thank you.
You're welcome.
We have Member Jackson that wishes to be heard, and I think he's with us on Zoom.
Thank you, Mr. Chairman. It's always good to see Dr. E. And in full transparency to the committee and you, Mr. Chairman, my daughter attends this phenomenal institution, Clayton State University. So a question, will this survey not only position Georgia to know what type of nurses we have in Georgia? So if we have, let's say, hurricanes or tornadoes, we need to render a proper assistance, that this database will properly position Georgia to respond accordingly, because we all know that there are different nurses that have different skill sets, and being able to respond appropriately, a survey like this will assist Georgia.
Thank you for your question, Representative Jackson. Yes, absolutely. You know, right now we know Georgia has a shortage, but we really have to rely on national data, which the national data sets vary widely in terms of what they say about Georgia. And so we would like to rely on accurate, complete data that we collect ourselves about Georgia, because we know that that would be more accurate. But unfortunately, for almost 10 years now, we've been struggling to collect data ourselves. So we're caught unawares because we don't have an adequate data set. And so I think if you've been watching the news, you know, in COVID, we have lost many nurses to New York, Texas, and other places who are paying phenomenally high salaries to traveling nurses. And we have no idea how many nurses are leaving Georgia to go elsewhere. And so to be able to track employment through their zip codes, it would help us to know how many nurses are leaving Georgia and where these pockets of shortage areas are. So absolutely, it's essential to us to be able to track trends, and we can't do it unless we have some way through a survey like this. So you're absolutely correct. It would allow us to have meaningful, accurate, and robust data from a survey like this. And we've tried other ways to do it through the Hospital Association, but it's just not possible. We haven't found any other way to do it. But this would give us a way. Medicine has a way to do it, dentistry has a way, and physician assistants have a way to do it. And relicensure is the way to do it.
Thank you, Mr. Chairman.
All right, any other questions from any of the committee members? You got a, what number would you have? 17.
17.
Thank
Thank you so very much, Mr. Chairman. And this is so timely. And thank you, Doctor, for bringing your information on data collection. Just today, the Women's Caucus had 3 guests to come and speak to us about the shortage of nursing in Georgia, and it is serious. And it was also interesting to see, as the doctor has alluded to, how Georgia is losing nurses to traveling nursing profession. And so I want to thank and commend you for the insight to gather the data, particularly on cultural competencies. And also, as a leader in gathering this data on cultural competencies, I just like to say how important it is that we begin to recognize cultural competencies across all medical professions and gather the data. So I want to commend you for being a leader in that area. Thank you.
Thank you.
Thank you, Representative Bennett. Any other questions from any of the committee members? Do we have anyone else who wishes to be heard, wishes to testify on any parts of this bill? Any changes from any of the committee members, or y'all like it the way it is as I send it forward to the GORP committee? Well, if not, then that will conclude. Yes, sir. Representative Linsky.
Thank you, Chair. On line 54, when it's talking about the roles, 4 roles specified under that paragraph, do you know anything about that?
Which license
Page 3, line 54.
of the bill?
Yeah, do you know, does anybody know, when we say one of the 4 roles specified, it's in the code section. I just want to make sure.
Thank you. I'm tired.
I don't have that code section.
Yeah.
I think if you'd look, I think Representative, if you'll go, I know you're an attorney and I'm not, but if you'll look on line 31, I think you'll see the 4 that's mentioned there, reference back to 1.1.
Line 31, okay.
Oh, it's 1.1 of this code section. 43. Oh, it's
Oh.
amending with that 1.1 is, that's why.
Any
Yeah.
further questions?
Thank you, Chair.
Oh, you're more than welcome. Now, do we have another question? Another question? All right. All right. Now, do we have any other questions from any of the committee members or anyone in the audience? And if not, I'm going to assume that the committee is all right with this language, and this will be the substitute that I will forward to the GORP committee at OPB. No problems with that? Very good. Well, then if that's so, then this meeting will. You don't need a motion. I got to send it to GORP before this bill's eligible. So that being said,